Welcome to the Department of Pharmacy. The Department of Pharmacy falls under the Faculty of Pharmaceutical Sciences. I'm Dr. KIRUI, HOD Pharmacy. Welcome. The Department of Pharmacy has got two programs. We have Diploma in Pharmacy and Higher Diploma in Pharmacy. The Higher Diploma in Pharmacy is coming up, and it will take 1.5 years duration. And the programs which have been lined up to be launched in the near future is clinical pharmacy and herbal medicine. Other programs may come up at a later time. The Diploma in Pharmacy program is currently offered in 6 campuses across the country in KMTC. We have Mombasa, Mansa in Machakos, Nyeri, Nakuru, Kisumu, and Nairobi. The Diploma in Pharmacy program is a 3-year program. And this 3-year program is divided into semesters. In year 1 and year 2, we have 2 semesters in each of the years. And particularly in year 1, they do the support subjects, while in year 2, they do the clinical subjects. The professional practice experience normally is done in year 3, semester 1, which will take students over a period of 7 months. And during this period, they have 3 components. We have the hospital practice, which is 3.5 months, community practice 2 months, and industrial pharmacy practice 1 month. While the students are during this professional practice experience, we have the mentors in the field which are able to supervise the students, but also the lecturers do follow-up visits during which they will be able to check the skills and the knowledge that will have been acquired. Also during this particular period, we use a logbook to monitor the progression of the student. And at the end of that 7-month period, the students come for a 10-week period during which they will be in class, and then they do the final qualifying examination. Earlier, the minimum requirements for the course is very critical. We are being regulated by the Pharmacy and Boyson's Board, and we have the minimum requirement for entry. One of them is you must have, the minimum requirement is Kenya Certificate of Secondary Education with a minimum grade of C, and the following are the specifics which are required: English or Kiswahili, plain C; chemistry and biology, plain C; mathematics or physics, plain C. And once they are taken in, normally we take twice a year. The admission is in March every year, and also September of that same calendar year. So which ones are the modules we normally do here? The major modules, the key modules that the students undertake is pharmacology and toxicology. They also undertake clinical pharmacy. They undertake medicinal chemistry and pharmaceutical analysis. They also do dispensing, pharmacy law and ethics, pharmacognosy, the professional practice experience over the 7 months period, as I had said earlier, and also they do pharmacognosy. While I'm still in the key modules, the students also do research. They do a project before they complete, and that is normally done during the 7-month period when the students are out. So what is the role of these graduates upon completion? What is their role? One of them is to fill prescriptions. Fill prescriptions, they are able to dispense the drugs. They are able to select, procure, and distribute drugs. They are also able to manage community and hospital pharmacies, pharmacovigilance, and quality control and quality assurance in pharmaceutical firms. So that is what they are able to do. And they are also able to work in insurance companies, particularly those insurance companies who have medical schemes. They also engage our students. And they are also involved in sales and marketing of pharmaceutical products. The award that they get upon completion, it is Diploma in Pharmacy, and Upon graduation from our college, Diploma in Pharmacy, they are enrolled by the Pharmacy and Boys on Board, and during this period they sit for level 2 examination, and thereafter they will get their enrollment certificate and they will be able to practice as pharmaceutical technologists. So where do these students work after they complete their studies? Where these students work after they complete their studies, they do hospital practice. And in hospital practice, we have public hospitals, we have private hospitals, and we have faith-based organizations. So that's where they work. They also work in community pharmacies. In these community pharmacies, either they are self-employed or they are employed, but it is always many of the graduates would like to employ themselves, but this normally comes after a period of serving in the community pharmacy. They are also involved in pharmaceutical industry. When it comes to pharmaceutical industry, either they are dispensing the raw materials, either they are analyzing the raw materials, and they may also be involved in sales and marketing of the pharmaceutical products those companies produce. They may also be in research. They may get involved in research. They may also be engaged in pharmacy laboratories to be technicians. They can also be in insurance companies, as I have said. And these are the areas where the pharmacy technologists may work. They may also work with the regulatory body as drug inspectors. So they may also be engaged in the drug inspectorate unit of the regulatory body, the Pharmacy and Poisons Board. At the end of the period, they progress to higher level. Most of our students, those who have done very well, will progress to degree level, and there are quite a number of universities within the country which currently offer Bachelor of Pharmacy, and there are about 4 or 5 of them. And apart from Bachelor of Pharmacy, they can also pursue other disciplines like public health. Quite a number of our students have pursued that. Some of them have pursued the chemistries, and we have quite a number of them who are now lecturers and serving in various organizations within the country. They may also pursue higher diploma in pharmacy if they have done the basic course. That means they can be able to come for the higher national diploma in pharmacy, which we have said will be coming up, and that will be in clinical pharmacy and herbal medicine. Other programs may come later at a later time, but those are the ones that will come shortly after this. And who are our partners? Basically, our partners are basically the Pharmacy and Poisons Board, which is our regulator. We have the hospitals, national referral hospitals, level 4 and level 5 hospitals. They do provide practicum sites for our students. We have community pharmacies. Community pharmacies, most of them are private, so that is where they work. And industrial farms, quite a number of industries which manufacture pharmaceuticals are also our partners. And also the telecommunication providers, now that we are using the e-learning platform, they actually are very useful. We partner with them to see how learning can be smooth as we reach our students who are currently out of the station. Pharmacy is basically a health profession that deals with safe and effective use of pharmaceuticals. Please welcome to Kenya Medical Training College, Pharmacy Department for your training. And the minimum requirements we have already stated. Welcome, study with us. We look forward to seeing many of you joining us across our campuses. Thank you very much, and may God bless you.